Hello, I am Dr. Prashant Tejwani, Senior Orthopaedic Consultant working in the Department of Sports Medicine as an arthroscopy surgeon. Sports are no longer a recreational activity and many youngsters are taking it as their professions. They are passionate about the sports like football, cricket, tennis. With growing sports, we are seeing more sports injuries and knee being the most common. The knee consists of the thigh bone, the leg bone covered with the cartilage, and our knee joint is cushioned with two structures, we call it meniscus, and the knee is supported by the ligaments towards the side, we call it collateral. The most important is the intra-articular or inside the knee ligament, we call it as an ACL and PCL, which are more prone for injury in the sports. The ACL ligament injury is the most common, and the most common cause of injury is the twisting of the knee while playing football, or those who are a volleyball player, they jump, they twist their knee. People who are a kabaddi player, they twist their knee and they get the ligament injury, and typically they'll hear a pop sound and patient is not able to walk after that. Sometimes it may not be a significant injury, they may have a minor twisting, then they are able to play, but after a day or two the knee starts getting the swelling. When a patient comes with the knee injury, the most important is what to be done. Whether I need an X-ray, I need an MRI, is it a bad enough, do I need a surgery? These are the common questions we face. Whenever a patient comes with any injury, the first priority is you give rest to that part. We immobilize the knee with a long knee brace, we allow them to walk, give them medication, ask them to apply ice. One of the most common problem or misconcept is they apply this ointment, gel, and we advise them please don't do that because they increases your pain. Once you have given rest to that part and patient is comfortable, the next stage comes for the investigations where practically the X-ray may not show anything. We go for an MRI which tells us clearly about whether you have an injury to the meniscus or the cushion or the ligament. Patient come to us with an MRI report showing the ligament injury or the cushion injury. The first question is that, do I need a surgery? I have shown to a place where the doctor has told you have a ligament injury, you have a cushion, immediately go for surgery. But we have to understand is these are not an emergency surgeries. First priority is as soon as the injury happens, we should give enough time for the soft tissue to settle down. Approximately a week to 10 days where knee becomes silent, you are able to bend 90 degrees. That's the right time for us to intervene or surgery. A young athlete has a ligament injury, particularly the anterior cruciate or the front one, you have to operate and put a new one, because if not operated, your knee is not stable. You will have repeated friction of the joint and you are going to damage your joint, which we normally see the wear and tear at an elderly age, which we will see in a relatively younger age. Nowadays we have a special technique called keyhole surgery, which we call arthroscope, where we put a small camera in the joint. We assess all the structures. How is your ligament? How is your cushion? Once the ligament is broken, we operate it. We take one of the tissue from your thigh, the hamstring muscles, the part of that muscles is taken and we reconstruct the ligament. You have to understand these ligaments are non-viable. Once broken, we cannot stitch it, they will not heal. We replace it with a new ligament and we fix it with a screw, which are nowadays a bioabsorbable screw, where you fix the ligament, you don't have to remove the screw, they get dissolved in the body. And at one end you may have sometime a small titanium button which never gives problem in the future, whether you go for an MRI scan or you going through the airport. Because we are using the pinhole or an arthroscope, it gives us an advantage that there is a minimal soft tissue damage. Next day we allow patient to stand, we give them a long brace, make them walk. Practically if they are comfortable, they can go home on the second day. If a patient is having only a cushion injury, we just go in, we nibble that or treat that, and patient even can go same day as a daycare procedures. So once the surgery is done, patients are discharged, they are advised to take rest, walk with the help of walker, and we review them after a week in the OPD. Once they come for a follow-up after a week, we allow them to strengthen the muscles, we allow them knee range of movement, allow bending of the knee so that they are able to sit on the chair and they can travel. So if you are facing any of these knee related injuries, please visit the clinic.